So, on that note, right, since we talk about the art and business of therapy here, um, our audience and myself are particularly interested, and maybe some, coming out the gate, what are some myths about ADHD, and how can we level up as therapists when what should be top of mind when a client walks in the room and we suspect or we know they have a history of ADHD?
I think if you know, that puts you ahead of the game. You can talk to them, you can get a lot of their information. It's probably harder for you when you don't know or it's not known because it can mask as so many other things. I think when you have the clients, taking the time to really get to know them and understand our knowledge of ADHD has changed and is changing so much. And for so many people, even us, when I was in education, we say ADHD and we think of the 8-year-old boy who is bouncing all over the tables and can't control. And we don't see girls or women or older men, adult men, not older men,
Hmm. Hmm.
um, having it if they aren't exhibiting those behaviors. And a lot of the time it's because they've really learned to mask whether they knew they had ADHD or not, especially girls and women. They learned to be good girls. They learned how to play the game. They learned how to be quiet and and do what they needed to do. So they may come to you also presenting that. I
Hmm.
come in, you're a new therapist, and I want to present as a good client. I want to
Hmm.
present in all these ways, and I kind of know how to play some of the games. So I or the client may be doing things like we're really good often at reading the situation or reading
Hmm.
what another person wants. And so we can kind of tell what we're supposed to be saying or what we're supposed to be doing. I think if it's I can't speak. If it's suspected, going in with an open mind, because as you may know, you may not know, a lot of times it's misdiagnosed or co-diagnosed with depression, with
Hmm.
anxiety, sometimes with autism or other disabilities, learning disabilities, anything like that. And so it can be really hard to ferret out what is what, but kind of remembering that all of these are part of your client and trying to figure out, I guess I would say, what their needs are in that time. I know I can speak from some personal experience.